Dr. Jason Tomsic, Real Doctor Skin 3 here, and I just want to take a couple of minutes to talk about how we do our liposuction. So we do something a little bit different than some practices do. If you see a lot of people do liposuction, they just liposuction half of the abdomen at a time. Their strokes may not be very close together. And that has a tendency to miss more places when you're doing liposuction. So we use something called the methodical block technique, and that's something that our medical director, Dr. Dominic Brandy, came up with years ago. What we do is we divide the body into boxes, abdomen, back, arms, anywhere we're doing liposuction, we divide into boxes. So you have two symmetrical boxes, one on each side of the body, like a mirror image. We're going to count the number of liposuction strokes in those boxes. So the mirror box on the opposite side will get the same number of liposuction strokes. We're also coming from a 90-degree angle, so you get liposuction from one direction and the other. And so that's going to keep things more symmetrical. Now keep in mind, nobody is perfectly symmetrical to start with, and we know that. So besides counting the number of strokes, we're also going to be doing a pinch test, pinching around, make sure we don't need to do a little bit more liposuction in one area as opposed to another to get you a little bit more even. The other thing with a methodical block technique, which helps to work really well, is when you have a smaller box that you're liposuctioning in, it forces you to keep those liposuction strokes closer together. You can be less likely to miss areas, less likely to go over areas too many times and create a large divot. So that is why we do our liposuction the way we do. It takes extra time, it takes extra effort, but it gets a more consistent result.